February is American Heart Month, and Dr. Rita Redberg is with UCSF and joins us now to talk about heart health. Good to see you. So let's talk about cardiovascular disease. What exactly is that, and how much of a problem is it?
So, great question. Cardiovascular disease means any kind of disease of your heart or the blood vessels. So, most commonly, stroke or other diseases like that. And it is the leading cause of death in the United States as well as worldwide.
How do you diagnose cardiovascular disease?
So, most commonly, cardiovascular disease means some kind of blockage in one of the vessels that feed your heart. And that is usually diagnosed because somebody comes in with chest pressure, like a tightening in the chest when they're exercising or under some kind of stress. And then we can do any kind of non invasive tests, like a treadmill test or a stress test, or occasionally an invasive test involving catheterization or sometimes a cardiac imaging test like a CT.
Well, there are some at-home devices for heart monitoring. Are they accurate, or are they even worth it?
Well, that is a really timely question. I mean, here, especially in Silicon Valley, where we develop a lot of these devices, they can definitely give you information. What we don't have is whether that information is actually helpful to improving your health. So there are people that like to monitor their heartbeats, and that could be useful, but sometimes it could lead to unnecessary worry and anxiety. So at this time, I don't generally recommend them unless your doctor has particularly recommended one for you. But some people do just like to keep track of those things like their heart rates.
So what can we do to improve our heart health so we don't have to go to the doctor?
Okay. That again is a really good question because most of what you can do is actually things you don't need a doctor. And I'm a cardiologist. We're very busy, but I'd rather see less people. And so to prevent ever having heart disease or certainly delay it, it's pretty basic. Eat a good heart healthy diet, which means Mediterranean diet, a lot of fruit and vegetables, which we're very lucky to have plentiful quantities of in the Bay Area. Lots of whole food, try to minimize food that comes out of boxes and cans. Get regular exercise, walking, or anything else you enjoy. But if you can do it most days of the week or every day, it's fantastic. It will really cut your chance of having any heart problems. And then, of course, no smoking.
All right, very good information. Dr. Rita Redberg with UCSF. Thank you so much.
Thank you. It was a pleasure.